And now we are going to hear from Dr. Josephine Kim, a senior lecturer at Harvard Graduate School of Education and the former faculty director of the Office of Diversity and Inclusion at Harvard School of Dental Medicine.
Hey everyone, thanks for having me. Thank you, and thanks for that intro. And I want to talk a little bit about the mental health of our students, especially how lack of representation impacts their mental health. And when we think about social determinants of mental health, we can't help but think about the conditions in which students learn, participate, socialize, and grow. And we have to realize these conditions are shaped by the distribution of power, how they access resources, how they're represented in the curriculum, their sense of inclusion and belongingness, and their sense of safety. And when it comes to mental health, we're really looking at inequities in these conditions that are responsible for the mental health disparities. Now, when we think about this, I mean, let's name it for what it is. Lack of representation in the curriculum is structural racism. Let me say that again. Lack of representation in the curriculum is structural racism. And if schools fail to uplift, represent, and incorporate students' cultural identities, their histories, and their lived experiences, then essentially students' identities are being minimized and erased. That is being told you're insignificant, you don't matter. And because it's erased, it's purely by default because it's missing. And when this happens, they're forced to give up their cultural heritage and they're forced to assimilate. And this is a picture of what that assimilation looks like. It is essentially cultural genocide, removing any marker of your cultural heritage from the way you speak, from the way you dress, from the way you think, right? And essentially, again, we're erasing their identities. And so I want to leave us with this quote: there is no passive stance in this work. Lack of representation is erasure. It is structural racism. And when schools are not actively anti-racist, it is by default entirely racist. We also know this lack of representation impacts greatly the mental health of our students. For example, it perpetuates a low sense of belonging, which we know to be a predictor of depression. It also perpetuates a culture of stress, the stress that comes from trying to fit into a host culture that is so different from you. It increases imposter syndrome, this idea that you don't belong, you're going to be found out, right? That you're pretending to fit in. Also, this minority stress just purely from the fact that you might be a minority member in your classroom and you're not being seen in the curriculum. There's also that stereotype threat, this fear that you're going to confirm the negative stereotypes that exist about your community. And that anxiety is so great and intensifies that you actually don't do well on tests and exams and other performances, right? And so essentially, I want to conclude by saying we could either say our students are really struggling with mental health, or we can contextualize it and say, you know what, they're actually struggling with oppression and stigma and lack of representation.